Ghouls, goblins, and monsters aren't the only things that you should be scared of this Halloween. Bad teeth are scary too, and JH Emergency Dental wants to help.
Dr. Samuel Escarcega, you're with JH Emergency Dental, and I'm really happy to have you on Great DSA this morning. So good morning.
Good morning, Clark. I'm happy to be here.
Thank you so much for being here today. And you're in the business of emergency dentistry. So I'm genuinely really curious to know what cases you've seen recently that's deemed emergency service.
Good question. So emergency, most folks, when they hear the word emergency, we're thinking pain, infection, swelling, patient can't sleep at night, and we see those quite a bit. We also have folks that come in here. We had a lady last week that came in and had no pain, but she had a broken front tooth, and she was going to a wedding or the weekend that we saw her, and she was really concerned because she'd been meaning to take care of it. She hadn't been able to find the time, and she was really stressed if there was anything that we can do. So we were able to repair her tooth, make it look beautiful for her. She was very happy with that. And for that patient, that was an emergency, that she needed someone to see her prior to going to that wedding so that she looked the best and could smile in the photos.
You're saying that it's not always associated with pain in emergency cases.
Exactly. So my belief is that most people, like how you said, when we hear emergency, we kind of really understand, or we go right towards the pain and the infection, which are real emergencies, and folks will seek me out, and we see an overwhelming number of our patients actually do present with pain. They haven't slept, the tooth is broken, they have a swelling. But what I'm also seeing now too, though, is that folks who haven't been to a dentist a long time, they've had a broken tooth that's been there, they know it, they see it every time they brush their teeth, and they just haven't found the right doc, or they haven't found the time to get it taken care of, and so they come in and see me. And those ones, what we find oftentimes is that there might be an infection underneath that tooth that's broken. It's just not hurting them. There's no pain at that point in time, but if they had put it off any longer, eventually it would have turned into something more serious, like what you were saying, swelling, pain. At the very worst end could be hospitalization and a risk to life.
But how would you recommend someone get help? What level should they be at in regards to receiving help?
Well, definitely what I want to communicate to all the folks out there in San Antonio is that I don't want them to wait. Dentistry is one of those things oftentimes when life gets tough, like right now we have COVID, people are worried about jobs and things of that nature. It's very easy to put off a dental concern. They might have a little sensitivity, or they might have a little pain, but nothing extreme. So they put it off and they put it off, and everyday life gets in the way. What I would encourage them to do is come see me, give me the chance to look at them and provide a solution for them before it becomes very painful or swollen, because at that point in time, what I can do is sometimes very limited. And at the worst end, as far as the tooth is concerned, sometimes I can only extract the tooth. And then that becomes a whole other issue down the road as far as how to fix that space, what can I do? So I want folks to know that there's an option for them. We are here on the weekends to see them late at night. And the sooner they can come see me for any concerns, whether they're painful or not, the better options and the more options I have to offer them.
Special offer for everyone. You can get a crown for $795. Call now to be seen today at 210-796-4663. And if you have a dental emergency, well, you can head over to 14845 Nacogdoches Road, suite number 5. Call today and you'll get seen today, y'all. Make sure to visit their website as well, jhemergencydental.com.